Let's talk about finasteride, also known as propecia or proscar. I'm Blake Brooks. I'm a board-certified dermatologist and hair specialist, and I prescribe finasteride numerous times a day. Finasteride is a 5-alpha reductase inhibitor. 5-alpha reductase is an important factor in male pattern hair loss because it converts testosterone to DHT, or dihydrotestosterone. And we know that DHT is a bad player in male pattern hair loss. Watch my video on male pattern hair loss for more info on this. And while we don't understand what causes female pattern hair loss as well, it is thought that 5-alpha reductase plays a role in part because women respond to blocking it. Ultimately, blocking 5-alpha reductase stops DHT levels from going up and therefore stops DHT from affecting the hair follicles and causing hair loss. Finasteride is approved for hair loss in men under the trade name Propecia and has excellent data backing its use. It was originally thought to be ineffective in women when tested at the same dosing as men, but later studies showed that it was effective in women, albeit at higher doses. So I generally prescribe a pill called proscar to my female patients, which is 5 milligrams of finasteride, as opposed to the 1 milligram of finasteride I prescribe in my male patients. The use of finasteride is considered off-label in female patients, but in the right population, I find it to be very effective. Finasteride specifically blocks type 2 5-alpha reductase, but there is another medication, dutasteride, that blocks type 1 and type 2 5-alpha reductase, and therefore is thought to be potentially more effective. But it has a longer half-life and is not FDA approved for hair loss in men or women, so I generally don't prescribe this until my patients have been on finasteride and have shown that they're tolerating it well. Mainly because that longer half-life means that if you have a side effect with dutasteride, it's going to last longer after stopping the medication because it takes longer for the medication to leave your system. I use these medications in male and female pattern hair loss, but they are also very important for a lot of scarring hair loss processes like LPP and FFA, which I'll cover in other videos. There are side effects to be aware of with these medications, and they may not be the right fit for every patient. However, if you don't have any contraindications to taking the medications and are comfortable with the side effect profile, they can be incredibly helpful. I know side effects are a very large concern with this class of medications, so I'll cover that in a separate video, so stay tuned.